Thanks, Lassie and Corla. I want to ask the Minister for Health the waiting times for child and adolescent mental health services in the Dublin 7 and 15 areas, and if he'll make a statement on the matter. We've an ongoing crisis in our CAM service with recruitment shortages, ongoing delays, and many children being dismissed and turned away from a service because their diagnosis or presentation doesn't match the severity which the service can provide for. And I think, you know, as Minister with responsibility for mental health, there hasn't been any type of improvement, in my view, in the quality of the service, and also the fact that children are having to continually be admitted to adult units, and the fact that there's not a 24/7 call service is shocking in the context of a €17 billion budget.
2 minutes, Minister.
Developing all aspects of mental health remains a priority for Government, reflected by the additional €55 million provided in Budget 2019. Bringing the overall HSE funding this year for this key care programme to €987 million. Demand for CAM services increased by over 20% for referrals since 2012. All aspects of CAMs nationally are being improved by the HSE under its annual service plans. This includes better out-of-hours and 7-day cover, progression of day hospital care, developing specialist teams such as eating disorders, and improved prevention and early intervention. There are now 70 CAMS teams and 3 paediatric liaison teams. Around 18,100 CAMS referrals are expected in 2019. Cases assessed by professionals as being urgent are seen as a matter of priority. There are 76 CAMS inpatient beds in 4 acute units nationally, with plans for additional beds in the new Children's Hospital and the new Forensic Mental Hospital, which is being built at Portrane and due to open next year. Additional funding allocated to mental health services since 2012 has provided for the recruitment of over 1,500 posts in mental health, including a significant number relating to CAMS. The total number of children on the HSE CAMS waiting list in January 2019 was 2,523. In Community Healthcare Organisation Area 9, which covers the areas of Dublin 7 and 15, the total amount on the CAMS waiting list was 193. There is currently no waiting list for the North Inner City CAMS team, Grange Gorman, which covers the Dublin 7 area. There is currently a waiting list of 68 for the Dublin 15 area, primarily due to a consultant on leave, which has resulted in delays in routine appointments. A locum consultant psychiatrist has taken up duty with the Castleknock CAMS team from the 5th of February. This will see a return to more normal levels of activity and a reduction in the waiting list. Prior to this date, cover was being provided via an arrangement between existing CAMS consultants across other CAMS teams in Dublin North City and County. I regularly meet with the HSE to review progress on all aspects of CAMS. In addition, I recently wrote to all executive clinical directors concerning recruitment and retention issues with a view to improving staffing levels on CAMS teams.
Minister, please. The remainder will be in the official report.
Okay.
Deputy Chambers.
Yeah, Minister, I suppose what we received from you was the classic response that there's more funding being allocated, and we accept that. But that's one of the problems we have. Like, how much more money does your government want to throw at all the issues without actually getting service delivery? And I think we're spending second, I think, in the OECD now on health spending per capita, but there's actual delivery, and that's what parents and children care about. It's not about how much you're allocating and how many more consultants that you're talking about. It's how can they see a consultant as quickly as possible? How that the figures are gone worse. We've 193 now versus 186 in November. You mentioned a consultant out and nobody there, nobody in an area to cover a population the size of some cities in Dublin 15. Nobody to see someone, and care being burdened then by other consultants who already have significant waiting times. And my serious difficulty is that I'm aware of children who have a particular diagnosis that are being referred from GPs that are being told by CAM, sorry, your diagnosis doesn't match the level of severity that we can deal with, despite it being within diagnostic guidelines of their own service delivery. And that's a serious issue. If someone presented to A&E with a significant acute problem on a physical basis, they wouldn't be turned away and triaged on the basis that their issue isn't serious enough. And I think we've a deep underlying issue here.
Minister to respond. Minister, just take 1 minute.
I'm not sure if the Deputy has ever heard me speak on this issue before, because if you did, you wouldn't be making some of the statements you're making. I have always said that throwing money is not a solution, and it's interesting to hear that from Fianna Fáil, because you have always looked for more money in this area, and every other area that you raise in health is money you look for. I don't agree that additional monies is what's required. It's additional reform, and it's real reform. I have a serious issue with the referrals up to CAMS, and in a lot of cases the referrals aren't appropriate, and I'm glad to hear that the CAMS teams are pointing to that fact, that some of that they're not appropriate. What have I done to reduce the... And if you don't want to listen, Deputy, it's fine as well, but you have asked a question. Yeah, we can move on if the Deputy doesn't want to listen.
No, listen.
With respect, Minister, you take a political charge in your response to a very serious matter around the diagnostic management of patients with severe mental illness. And you made a political charge in the response to that. And with respect, as Minister for Mental Health, I've heard you talk more about rural taxis and telepsychiatry to get headlines in the Irish Independent than I have heard about solutions around mental health services. It's a disgrace that you've made a political charge. I was trying to be constructive. I agree with you that more money, it isn't about throwing more money at the HSE. It is about delivering services. That's what you're in an executive position for. That's what you're there to deliver for mental health services. It's not about making political charges and talking about Fianna Fáil. We're trying to be constructive. We're trying to provide solutions. But you're not doing that. You're not delivering. You haven't made any positive changes around CAMS in my area, where we've seen a worsening of waiting lists, where your government have allowed vacant consultant positions to leave children with diagnoses left behind. And that's your responsibility to act, not about getting headlines about Ruxies, coalitions with Sinn Féin or telepsychiatry. Deal with the matters that you're in government for. Deal with your own responsibilities.
Minister, 1 minute to respond.
I'd be delighted to answer the Deputy's questions opposite if he's prepared to listen to what I have done. And what I was about to inform the Deputy was, and I didn't realise he was so sensitive to politics, but that's fine. What I have done is built a lower level of infrastructure across the country over the past 12 months. We have recruited 114 assistant psychologists and 20 psychologists and 10 advanced nurse practitioners directly for young people, the length and breadth of the country, including your own area that you represent, Deputy. And that has, by projection, by an independent evaluation that was produced by Limerick College last week for me, has shown that it will reduce the waiting list in primary care psychology by 1,350 young people this year. And that is real progress, and that is the future. It's not about reacting and throwing more money up into the CAMS system to deal with waiting lists. It's about proactive investment in lower level interventions that will stop people escalating up to that level of acuity.